Good afternoon, everyone, and welcome to the June session of our virtual Grand Rounds today. I'm Dr. Kim Newell-Green, and I'll be the moderator for today's session on adverse childhood experiences. I want to acknowledge this topic has been changed in a quick switch from the original Childhood Mental Health Services in California, and we're going to present on that more in the coming months, but we're super excited to have this incredible panel here today to talk about ACEs. Many of us know that 2 decades of research have demonstrated the lifelong impacts of trauma and toxic stress in early childhood, but many, even physicians and healthcare providers, don't know that these health effects impact people over a lifetime. Clinicians may recognize the pattern, but many don't even feel that they have the knowledge and resources to intervene and therefore are reluctant to screen. We have some great new resources and incredible leaders in California who are helping us as providers to figure out how to help our patients manage this. And so we're so thrilled to be talking about this today with some of those very state leaders. Before we start, a little housekeeping first. I want to acknowledge CDPH as our incredible partner in providing relevant public health education for physicians in California. Next slide, please. We're going to show our speakers' disclosures. Next slide, please. And just a reminder that this series is accredited for CME, and now newly we're going to be able to offer maintenance of certification. So you'll be sent a survey after the completion of the webinar. You attest your attendance, answer a few quick questions, and upon completion of the survey, we'll not only send out your CME certificates, but also forward the information for maintenance of certification. Next slide, please. Here's our agenda today. Next slide, please. And our learning objectives. Next slide, please. Okay. So we're excited to have this incredible group of experts. So I'll introduce them briefly and let them just get going. Dr. Sohail Sood is a dad and a pediatrician working with the California Health and Human Services Agency. He is now the director of the Children and Youth Behavioral Health Initiative, which is the state's multi-billion-dollar, that's a B, effort to transform services and supports for our children, youth, and families. Next, we have Dr. Makai Owen, who's a practicing pediatrician who works with system-impacted youth in the Sacramento County Juvenile Justice System. Prior to joining these efforts, he was a clinical advisor to the ACEs Aware Initiative and assistant clinical professor in the Department of Pediatrics at UC Davis. We also have Nancy Martinez, who is a member of the ACEs and Toxic Stress Campaign Youth and Young Adult Advisory Council, and so happy to have Nancy here. And last but not least, Dr. Shannon Tyne is a professor of pediatrics in the David Geffen School of Medicine, chief of pediatrics at Olive View UCLA Medical Center, the director of pediatrics for the LA County Department of Health and Human Services, and perhaps most importantly was my mentor during my pediatric residency at UCSF. In her current roles, Dr. Tyne is charged with advancing academics in the safety net, and she's currently a co-PI for the UCLA UCSF ACEs Aware Family Resilience Network, which is a large multi-campus effort on behalf of the state's ACEs Aware initiative. So with that, I'll pass it off to Dr. Sood, who will start our presentation today. Thanks to you all.
Thank you so much, Kim, and thanks to the California Medical Association for the opportunity to be here. My role today is just to take a few moments to provide some context around the work and the fantastic presenters from which you'll be hearing more momentarily. As Kim mentioned, the Children and Youth Behavioral Health Initiative is really a multi-year, multi-billion-dollar effort to reimagine the way we deliver behavioral health services and supports in the state. I don't need to remind this audience about the scale of the mental health and substance use crisis we have here, not just in California, but certainly throughout our nation. And ultimately, the approach to it needs to be different. It needs to be reimagined. And part of this is certainly transforming, all of this is really transforming the way we support our children, our youth, and our families. And part of the solution really involves the healthcare sector, right? We need to do more to support the provision of behavioral health care. And funding through this initiative is going to components such as expanding training slots for psychiatrists, the construction of new facilities, outpatient centers, more social work programs, more nurse practitioner programs. So many supports in the healthcare sector. But as you see on this slide, we know this crisis cannot be solved by a strictly medical model. For many, the ways our psyche gets hurt and the ways we heal, they don't start nor end really in that doctor's office. And so going upstream, prevention oriented, equity focused, youth centered, all of that means looking at the other spaces also where our lives play out. And part of this initiative is the funding is really going to supporting homes and communities through parenting programs and youth centers, providing access to a new cadre of digital supports, working very closely with the education community as well to turn schools and higher ed into places where resilience is taught and really fostered. So I won't go into depth about any of these today, but it's on that backdrop that I'm thrilled to note our ongoing commitment to elevating the conversation about adverse childhood experiences. You can go to the next slide. So as you'll hear more about in a moment, our scientific understanding about ACEs is robust. And not just the impact, but also how to mitigate this. So today we're hoping that we can all collectively work to move this conversation out of the libraries and into the clinics, into the classrooms, into the streets. And through the Children and Youth Behavioral Health Initiative and other state programs, we are doing just that. So I'm delighted to pass it now over to Dr. Mikhail Owen, who will be providing additional background around ACEs and what they are and what the impact they can have on an individual and on society. From there, we'll pass it over to the amazing Nancy Martinez, who's going to focus on a new campaign that was just launched and with which we hope really all of you will engage and share that information out with your patients and your panels. And then finally, we'll hear from Dr. Shannon Tyne about the resources and approaches that all of us as providers can take in thinking about how to best assess our patients for these conditions. So with that, I'll turn it to you, Dr. Owen. Thanks.
Thank you, Dr. Sood. Again, my name is Mikhail Owen, and I'm going to be giving a little background about ACEs and toxic stress as a public health crisis. So I'm going to start with definitions. The term adverse childhood experiences, or ACEs, comes from the landmark 1998 study conducted with more than 17,000 adult patients by CDC and Kaiser Permanente. The term ACEs specifically refers to 10 categories of adversities in 3 domains experienced by age 18 years of age. And these were the categories that were evaluated in the original study. And the categories are listed here. And 3 domains are generally abuse, neglect, and household challenges. Next slide. And we know that in California, ACEs are very common. At least about 72% of California adults experience at least one ACE, and about 20% of California adults experience 4 or more ACEs. And we'll talk about why that's an important number in a bit. Next slide. While ACEs can impact everyone and affect all communities, it's important to note that there are significant disparities in both the prevalence and the impact of ACEs and ACE-associated health outcomes, especially for people who are women, low income, LGBTQ, Black, Latinx, Indigenous, and other people of color. Next slide. So why are ACEs and toxic stress a public health crisis? And ACEs dramatically increase risk for 9 of the 10 leading causes of death in the United States. And listed here are those 10 leading causes of death and the odds ratios for 4 or more ACEs relative to no ACEs. And I'll just go through a couple here, but as we can see, if you have 4 or more ACEs, you have two times the risk of heart disease compared to someone with no ACEs, and 4.9 or almost 5 times the risk of Alzheimer's disease as someone with no ACEs. And again, these are just listed here because these are the 9 of the 10 leading causes of death in the United States. But now there's dozens of physical, mental health, and social negative outcomes that have been shown to be associated with ACEs and toxic stress. Next slide. This slide shows the population attributable fractions of ACEs for health outcomes in the United States. And again, we won't go through them all here, but just to point out that in North America, 40% of illicit drug use is attributable to adverse childhood experiences. So if we could prevent ACEs going forward, we could potentially decrease illicit drug use by 40%. And we can see that this pattern holds for a number of poor health outcomes. Next slide. And because of those associations, ACEs are extremely costly. A recent study showed that ACEs cost California $1.5 trillion annually, based on the population attributable fractions that were listed in that last slide. Next slide, please. So we want to just take a second to talk about the biology of adversity. How do ACEs translate to poor health outcomes throughout the lifespan? Next slide. And this is a very simple graphic to try to explain that. Not going to go into too much detail here today. Happy to connect with anybody who wants to learn more though. But essentially exposure to ACEs and other early life adversities, depending on the balance of risk and protective factors and predisposing genetic vulnerability, can alter the biological stress response, disrupt the development of neuroendocrine, immune, metabolic, and genetic regulatory mechanisms, and lead to a toxic stress response, increasing the risk of mental, behavioral, and physical health problems. And just to be clear on the definition, we define toxic stress as prolonged activation of the stress response systems that can disrupt the development of brain architecture and other organ systems and increase the risk for stress-related disease and cognitive impairment well into the adult years. Next slide. And this is a kind of a framework for us to how we think about what the impact of toxic stress can be. We could just go ahead and advance the slide. So we talked in the previous slide about how the toxic stress response can disrupt neurological, endocrine, metabolic, and immune systems. And here we see that there are a number of health conditions in each of these categories that are associated with ACEs. And so these health conditions are associated in a dose-response relationships with ACEs, meaning the more ACEs that you have, the higher the risk. At a population level, the higher the risk for these diseases. Next slide. And it's important to point out, though we talk about ACEs in talking about the risk of toxic stress and ACE-associated health condition, that there are additional risk factors for toxic stress that are not ACEs. We focus mostly on ACEs because they're well studied and there's well-established odds ratios tying ACE exposure to adverse childhood experiences to the negative outcomes we described previously. But additional risk factors for toxic stress include things like community or school violence, racism and discrimination, housing instability, food insecurity, separation from a parent or caregiver, or having a parent or caregiver who died. Next slide. So up to this point, we've talked a lot about the impact of ACEs, and we haven't talked much about protective factors, which we'll do a little bit later. But as we talk about ACEs, it's really important to point out that ACEs are not your destiny. One of the foundational principles of the ACEs Aware Initiative is that toxic stress is a medical condition that is amenable to treatment. So for children and adolescents, intervention can improve neurologic, endocrine, metabolic, and immune system development. And intervention in children, adolescents, and adults can improve physical and mental health, including ACE-associated health conditions, and may prevent the transmission of neuroendocrine, immune, metabolic, and genetic regulatory disruptions in the offspring. And we'll talk a little bit later about specifically what this can mean. So understanding that toxic stress is a medical condition that is amenable to treatment, and that ACEs and toxic stress are a public health crisis, there's a lot of work that California has taken on to try to reduce ACEs and toxic stress by half in a generation. Next slide. So this slide is kind of highlighting California's coordinated public health approach. So I talked about toxic stress being a medical condition that's amenable to treatment. We've done a lot of work with ACEs Aware, training clinical providers on how to screen for ACEs and how to respond with evidence-based strategies to mitigate the toxic stress response. But as Dr. Su said, that's only one piece of the work that needs to happen. And at the bottom of this pyramid, we see health equity policy changes, things like CalAIM and the Children and Youth Behavioral Health Initiative, public awareness and education, which we'll talk about later, cross-sector training and collaboration, and the work that's being done to bring sectors together, and work to support trauma-informed networks of care across the state. So this is all work that is happening in a coordinated effort across California to prevent, identify, and respond to ACEs and toxic stress. And now I'd like to talk a little bit about the public awareness and education efforts that are happening here in California. Next slide. With that, I want to talk about the recently launched Live Beyond ACEs and Toxic Stress public awareness campaign from the Office of the Surgeon General. And for this, I'll be joined by Nancy Martinez, who is a young adult advisor for ACEs Aware and for the Live Beyond campaign. Next slide. I want to start by talking about the intentions and the background behind the campaign. Through the state's historic CYBHI initiative, the Office of the Surgeon General was charged with creating a campaign to increase public awareness and understanding of ACEs and toxic stress, and to promote evidence-based strategies to help Californians heal. The goals of the campaign are to increase understanding of ACEs and toxic stress and support the prevention and mitigation of ACEs and toxic stress. Next slide. The campaign audiences are listed here. And for me, I practice in a youth detention facility, so it's really exciting that the primary audience for this campaign is youth and young adults, with an emphasis on ages 16 to 25, and with the focus on those who have been most impacted by ACEs. And in addition to focusing on youth and young adults, the secondary target of the campaign is parents and caregivers, with youth ages 8 to 16, and again, focusing on a broader community of adults, and different providers and community-based organization. So anybody who may work with children, adolescents, or young adults can benefit from the information that's included in this campaign. Next slide. And prior to developing this campaign, RAND conducted a survey in 2023 to learn more about California youth and young adults ages 16 to 25 and parents and caregivers about their knowledge and experience of ACEs and toxic stress. And that survey found that 60% of youth and caregivers have experienced at least one ACE, 23% of youth and young adults had experienced 4 or more, and 30% of caregivers had experienced 4 or more. And only 10% of youth and caregivers were aware of ACEs. So though individuals were heavily impacted by ACEs, many were not aware of what ACEs were or what their impact was. Next slide. The campaign is grounded in science and best practices and is guided by a panel of subject matter experts, including the former Surgeon General, Dr. Nadine Burke-Harris, myself, and my colleagues listed here. Next slide. But more importantly, the campaign makes significant efforts to center youth and young adult voices in the campaign development from start to finish, and to incorporate actual youth-created content. The campaign team worked closely with youth and young adult advisors through the ACEs Aware initiative. And on this slide, you'll see a diverse group of young people that met monthly, sometimes more, and have been really involved in every aspect of the campaign. And it's been a great honor to watch these young people incorporate their voices in this campaign, and watch how the campaign has responded to the voices of the young people who have been really impacted by ACEs and toxic stress. And I think that the changes that have been made and the way that the campaign has developed has just been incredibly compelling. And I think that's due in large part to many of these young people who have lived experience with ACEs and toxic stress. And with that, I'm happy to pass it over to Nancy Martinez, one of our young adult advisors at ACEs Aware and for the Live Beyond campaign. Nancy, the floor is yours.
Thank you, Dr. Owen. I'm very happy to be here and share a little bit about what we've done. And I'd like to start by sharing a powerful video that includes several of the advisors that were a part of designing this campaign. And there are many other videos that you can also find on the YouTube channel, but we can start with this video. I believe we might be missing the sound.
Maybe, Nancy, if it's all right, I will put that link into the chat. And I definitely encourage everyone to check out this really powerful video. And we can continue with the slide deck for now.
Perfect. That's totally great. Please watch that on your own time if you're able to. Okay, moving on. This is here what you'll see is a high-level overview of the Live Beyond campaign creative material. You'll see that there's a lot of messages that are invoking the themes of there's healing ahead, we can all live beyond our ACEs, start your healing journey, and there's other messages that are also trying to get shared with this campaign. In addition to the youth advisors, there was an additional testing with more than 200 other youth and young adults across the state that gave really good input into the campaign's look and feel, the messages, and of course the creative design. You'll see that there's stickers available. We know that stickers are super important to young people, and we like to put them on our water bottles and our laptops. Next slide, please. Here on this slide, you'll see that it includes the interactive and engaging site, the website where people can explore and gain understanding of themselves and their experiences. It serves as a platform that not only will encourage and support their own personal journeys, but also provide support that they can use to support their friends and their loved ones. The site has sections to learn about what ACEs are and what toxic stress is, their effects, and then it also provides the relatable content on the evidence-based stress busters. The site is available in English and Spanish, and it uplifts other CYBHI efforts that youth and young adults and their parents and caregivers can benefit from, including the recently launched virtual behavioral health apps like Bright Life Kids and Soluna. Next slide, please. One of the biggest elements of the website here also includes this story section that features real youth-centered and youth-created content, where you can also find my story. And in these stories, you can see and hear from young people across the region, across California, and hear from how they utilize and implement stress busters in their own way, what their messages of healing and hope they have for other individuals who may be struggling or healing from adverse childhood experiences. And then on the right side of the screen, you see some examples of what the content looks like on Instagram, Facebook, TikTok, and like I mentioned, YouTube videos. I really encourage you all to look and check out the website and see all the information that's on there and look at the stories of other young people, including Julio's, who you see on the right side there, and where he talks about how he came to terms with the physical health effects of his own ACEs and the toxic stress of when he was younger. Next slide, please. In addition to what I've shared already about the stories, there's also other campaign resources available online that people can download and print on their own. And these materials are all geared towards youth, parents, and caregivers and organizations supporting youth. We really encourage you all to direct any patients, inclusive of youth, young adults, parents, and caregivers, and others, to this campaign and to the resources that they have so that they can learn more about ACEs, toxic stress, and stress busters in a really reliable, relatable, and digestible way. Next slide, please. And I've mentioned the website, and the website where you can find the campaign information is livebeyondca.org. And you'll be able to find everything that I've mentioned so far right on this website. And then in the next slide, we can go over, I can give some more examples of resources. There we go, awesome. So here you'll see some of those examples that are available on the website, which includes a healing journal with writing and reflection prompts, as well as informative palm cards that define what ACEs and toxic stress are, with messages about healing and other evidence-based stress busters, along with ideas on how to implement some of them here and now. And then there's also bookmarks that have QR codes to curated book lists for youth and young adults, parents and caregivers, and I believe there's also a QR code for Spotify playlist, which I'll mention here in the next slide. But all of these resources are available in English and Spanish with translations in Tagalog, simplified Chinese, Vietnamese, and Arabic coming in the next 2 weeks. So we go to the next slide. Here's the example of the Stress Busting Tips folding pocket card, and it's titled Healing in Action. And this includes some of those mindfulness and in the moment techniques, such as box breathing and the stop technique. In addition to that QR code that I mentioned, that includes a link to the Live Beyond playlist on Spotify that was curated by the youth advisors. There's also a QR code to the Soluna app for real-time and on-demand confidential mental health support for teens. This is a great resource for young people and others, and they can use for quick and easy access to resources to help them manage stress and their mental health. And then finally, we have a campaign sheet that gives more background and many Live Beyond stickers, because we know how important those are for us and how stickers sometimes do pass the message on to others. And then and we can go to the next slide. There are plenty other resources and videos talking about ACEs and their healing. More are available on the website and then, of course, on social channels. So please check them out, share them with your colleagues and friends. I will just add that I shared a lot of resources yesterday with a lot of young people, and there's a really big demand to get the word out about this information. So with that, I'll pass it on to Dr. Shannon.
Thank you so much, Nancy. It's really important to include voices like yours in this work, and the Live Beyond campaign has such great potential. It's really exciting. My practice, I'm a pediatrician, as Dr. Newell Green mentioned, and I formerly practiced in San Francisco, but I now work in LA County. And our health system is actively screening patients of all ages for ACEs and toxic stress. And so I want to share a little bit about the ACEs Aware initiative and add a little data about the impact we've seen from screening in the community where I work. Next slide, please. So the ACEs Aware initiative, as many of you probably know, was a first in the nation effort to promote detection and intervention to address ACEs and toxic stress. And it seems like yesterday, but it was pre-pandemic in 2019, as part of Governor Newsom's California for All initiative, that the ACEs Aware campaign was launched. And it was a collaborative effort between the Department of Healthcare Services and the Office of the Surgeon General. And that partnership has carried on since that launch. And in October of 2021, the group that I work with moved the ACEs Aware campaign or initiative into an academic framework to really focus on implementing screening and responding to ACEs, but also advancing the science around ACEs and looking at the impact of screening in specific settings with specific populations, and also with relationship to specific diseases that we know are impacted particularly by ACEs. Next slide, please. So the goal of the initiative and its objectives were first to raise awareness through training and expanding screening among Medi-Cal providers, and then practice change, so supporting implementation of screening and response activities among Medi-Cal providers in the real world setting. And then really importantly, and something we've been focused on more lately, is building networks of care, which is to support development of a trauma-informed network of care that extends beyond the clinical setting, so to the communities around the patients we're serving, and now more specifically to the new funding streams that have been made available to members of California's Medi-Cal communities, so that we can make sure that the work that's happening not only gets coordinated in the clinical setting, in the community setting, but it also involves our stakeholder managed care plans and insurance providers to help ensure that the work that's being done and the services provided can get reimbursed. Next slide. So the ACEs Aware initiative offers screening training for screening, and also offers screening tools, protocols, and approaches to conducting screening, responding to ACEs, and then receiving payment for those services for both children and adults. And effective January of 2020, Medi-Cal providers can receive $29 reimbursement for each ACE screening of an eligible Medi-Cal beneficiary. And this is true for fee-for-service Medi-Cal as well as managed care Medi-Cal patients. Next screen. Becoming ACEs aware in California, we call it the BAA training. It's a free 2-hour online training that educates clinicians and their team members on how to provide trauma-informed care, screen for ACEs, assess for toxic stress, and use clinical protocols to develop treatment plans that help address that toxic stress. You can visit, well, I'm sure we'll show the QR code later, but you can visit training@acesaware.org for more information. But I will just say in my practice, we have trained all of our clinicians, but we also have asked all of our staff, ranging from the front desk to the nursing staff, to the social workers, to the community health workers, and even my high school and college interns that come work with us in the summers and during the school year, have all taken the training with the thought that the more we all understand trauma and toxic stress, the better we can work together to address it. Next slide, please. In addition to the BAA or the core training, we've actually developed an ACEs Aware Learning Center that includes multiple other trainings on evidence-based responses to toxic stress. We have webinars on specific topics for addressing ACEs and toxic stress in specific populations. And all of these activities give you easy access. You develop a logon, and then you can track them, and you can get continuing education credits. And you can also share them across your work domains so that other people in your services and working on your teams can get training as well. Next slide. Here's some examples of some of the programs that we offer. Implementation with Intention, for example, is a training that helps you figure out how to actually do this in your clinic or in your clinical setting. And then another example is ACEs and trauma-informed care in reproductive health. So that's a really great webinar that talks about what it's like in a particular health setting with a particular population and how you can integrate screening and response activities and understand the follow-up implications and the engagement with that type of patient as you address toxic stress going forward. You can see some other examples here, but we've prepared more than 45 webinars and trained more than 18,000 individuals and with 16,000 recording attendance at attending recorded sessions. So just lots and lots of training going on. And we're learning that the more trained individuals are, the better trauma-informed care, the better trauma-informed their practices are. And we really believe that aligns with California's goals for addressing health disparities among our communities. And so we're really proud of this work. Next slide, please. Another thing that we offer for clinical sites that are working to implement screening is technical assistance. Actually, on our website, there's a just simple form you can see here that allows you to email us and say, hey, we're trying to figure out how to address this billing issue, or what have you done when you do screening? Do you use an iPad or do you do it on paper? How do you integrate this into your electronic medical record? That kind of question. We have a site where you can reach out to us, and we have a strike team that's ready and willing to come assist. And sometimes they even come on site to help particular clinics address their specific needs when they're trying to implement screening and response activities. Next slide. So there are, I could go on and on, but there are so many things that we offer through the ACEs Aware initiative, and I'm going to go through a few of them. But the way we're investing in this work is through several very deliberate activities. One is public awareness. Another is cross-sector training and competency. As I mentioned, networks of care, what happens beyond the clinical setting. And thinking then about what happens in primary care settings, which is the originally intended site for screening for ACEs, for screening and responding to ACEs. And we're really trying to build up that screening in the primary care setting for children and adults, and then giving providers tools for responding. And so this slide just gives an example of, here's the Becoming ACEs Aware in California landing site when you take the basic training. And then on the right is an example of the risk assessment algorithm. So kind of what to do when you see what score and how you proceed. And all of these together through the ACEs Aware program, we hope will help providers and the clinical sites where they work engage in screening and response activities and build on that to utilize some of the new funding streams we see. Next slide. As you probably know, once you screen and once you know someone's ACEs, that's, as Makai said, that is not your destiny, but it can provide a starting point that is reimbursable for addressing what comes next. And some of the places where we're moving in the state are to programs such as CalAIM, which has multiple initiatives that include services to our constituents in California to help them improve health outcomes. Next slide. You can click forward to get the words. Oh, sorry. So part of what we're looking at in our clinical response are things like the Stress Busters model here, that you can see, which is applying trauma-informed care principles to these areas that all of us in healthcare know are really important. I'm particularly focused on sleep because I think kids and well, I'm an adult and I need to work on my sleep too, but quality sleep and good healthy routines are often really important for children as you try to assess whether they have anxiety, ADHD, or other PTSD, and trying to address what's going on and help promote health. And so in one of our clinical response overviews, for example, uses the Stress Busters approach, and part of what we teach through the implementation is how to incorporate Stress Busters into your clinical protocols. Next slide. And part of what that does is goes through the 5 steps that you've seen here and ends with how do we, now that we know your ACEs, now that we've addressed where you are with your toxic stress response and provide appropriate referrals, whether you need interventions such as better management of your asthma, or if you need mental health services, do you need social work or other agencies that can help support your needs. Addressing that and then setting up a follow-up plan that addresses any ACE-associated health conditions you have or that you might be at risk for so that you can mitigate them. So for example, if somebody is at risk for obesity or is starting to have a weight gain trajectory or a hypertension is starting to emerge, figuring out how to meet those patients where they are and see them potentially more frequently or modify their medications or their treatment regimens to try to help factor in the toxic stress experience so that you can maximize health outcomes. Next slide. And a lot of these resources are available, again, through our website. You can see here, and the QR code will lead you to them. And again, this is just a quick run through of the availability of resources on the ACEs Aware website. Next slide. I'm going to switch gears a little bit now to talk about what we're starting to see in clinics where we are screening for ACEs, and we've been doing so for more than 18 months. So we had kind of a natural experiment where I work in a large health system that serves over 500,000 primary care patients and almost 60,000 pediatric patients. We're screening in clinics across the health system that I work in, both adults and kids. And we started screening first with kids, so this is some of the data we have. And we arbitrarily rolled out screening. And so we just looked at what happened in the clinics that have been screening and responding to ACEs for more than 18 months versus those that hadn't yet. And we couldn't really do this as a pre-post design because of COVID. So the pre was a little bit altered. So what we did is we just looked at screening and non-screening clinics. And what you can see here is that in the clinics that had been screening for more than 18 months, the achievement of the quality improvement metrics for these items that you can see here were better in all of those clinics. And obviously, screening for ACEs in and of itself may not have led to these outcomes, but what we believe is when you provide trauma-informed care and when you think deliberately about how to provide services to meet the needs of patients that extend beyond the clinical setting, you establish workflows that allow you to do all of your processes better. So we're seeing better autism screening, better HPV vaccinations in these settings because, well, we believe because we're starting to implement workflows that are successful for patients, including building more trust, getting better follow-up, and having more engagement among patients with their treatment plans. Next slide. Another exciting finding is that with CalAIM launching initiatives to support responding to complex medical and social needs, we've seen the Enhanced Care Management Program we had challenges with identifying who to enroll because providers in managed care systems are not particularly good at coding for all the diagnoses their patients had. Well, because ACEs screening and response activities are billable in addition to Medi-Cal billing, so in addition to capitation, you get the $29 payment. When we screen for ACEs, it drops the code. And so when you query the code for screening for ACEs, and one of which is ACEs are 4 or more, we identified many, many more patients who were eligible for enhanced care management. Because if you have a score of 4 or more, you are automatically eligible because you're presumed to have a serious mental illness. So not really an intended consequence of the ACE screening initiative, but what we're seeing is that it's really expanding access for our patients. Next slide. And finally, just to wrap up, it's obvious through all you've heard now that we can't do this all alone. The way that we need to address the needs of patients who are experiencing trauma and toxic stress involves a multi-sector approach, everything from our system of healthcare to our justice system. And if we think about primary prevention and avoiding exposure to adversity, and then really working with secondary prevention. So once you've had adversity, to try to help prevent the negative consequences. And then if you've had the negative consequences, to try to address them so that you maximize your chances for improved health. Next slide. And just to bring this all back to the California's public health approach, we see all of you and all of us as in this together. And as you can see, it's starting with policy and leading up to public awareness and training and collaboration and building these networks so that the health of Californians extends beyond the clinical setting. And then in the top 2 tiers, really focusing on what we're trying to do with the academic or the evaluative side of implementing ACEs Awares, to really look at how the clinical algorithms are working, look at our response to ACE-related health conditions, and really continue research in toxic stress so that we know that what we're recommending for implementation is both evidence-based and then in a real-world setting where we can make sure that it's as effective as possible. Next slide. And again, just to give you the QR code again for the training, this is the training site. And we are certainly available to answer any questions. And I think I'll head to the last slide. which provides some of the other mechanisms for contacting us or getting engaged with the work we're doing. And I just want to speak for all of us in the ACEs Aware Initiative and say that we are really eager to partner with you and be supportive in any way that we can, so that you can work alongside us in trying to help mitigate toxic stress and trauma in our communities. I think that's it. Thank you. Next slide.
Incredible. So now I am going to invite everybody to turn their cameras back on so that we can answer some of the incredible questions that our engaged audience always has. But first of all, I just want to say thank you to these incredible panelists who have summarized a massive body of work in such an cogent and coherent way. And so I feel like we're all just beginning to learn about this, but now we have all the resources to educate ourselves. So I'd really love to start with a question for you, Nancy. What was it like, and why was it important for you and young adults to see themselves in this campaign? The co-design work that this project did seems so important to me, but I'd love to hear about that from your point of view.
Thank you, Kim. I mean, I think that we see that there's always resources of where to get help, that we get from providers and online, and it just never feels like these resources were made with youth in mind and the intended audience. It's kind of like, here's a resource, use it. And so to us, I think it felt like our voice was truly being heard and our experiences were really taken into consideration of how even resources that are already existing might be tweaked a little bit in the voice of youth. So I think it was really special for us to have as much engagement as we had in the campaign and have a say in the messaging that is coming across in the campaign.
Yeah, that's amazing. I even noticed the aesthetics look different than I probably would do if I designed them. And I know my own teenage child, like if we do a vibe check, I'm like, what do you think about these resources? And usually something that seems really cool to me is completely uncool to them. So, so it's great that you had that voice, not only in the content, but also the aesthetic. So that's super cool. What about maybe Shannon or Makai, whoever can answer this one? I know that many of us exist in practices where we don't feel like we have a lot of places to refer folks who might screen positive. So what if I don't have any place to refer my patients? I know there's lots of resources online, but do you have any specific advice for someone who feels a little more isolated in their clinical setting?
Yeah, I could take that one. So in my practice previously, I worked with youth that were coming home from secure detention facilities. And now I practice in a detention facility. So youth that are really, really impacted by ACEs and toxic stress. And I would say for me, as I've kind of gone through my journey in this work, one of the biggest aha moments that I've had clinically was helping youth and young people with, in the case of my practice, behavioral health issues and legal issues, understand how their experiences in childhood are linked to a change in physiology. I think with so many kids that I work with, they have a feeling of wanting to do better and sometimes feeling overwhelmed, wondering, why am I so angry? Why do I do some of these things that I feel like I can't control? And so many times I think helping to educate them on the science behind that and the neuroendocrine immune changes and what they can do to try to help regulate that response has been real helpful. So I think kind of learning how to communicate around the physiological changes and learning how to implement those evidence-based strategies in your practice is really a value add.
Yeah. So Makai, I hear you saying that like you essentially use a brief intervention strategy in your own practice. Shannon, do you have any tips for folks who, because we have so little time in our clinical visits, where can we refer folks?
I think there are a couple of things to say, and I agree with what Makai said, but from my perspective, one of the things I learned when I took the Becoming ACEs Aware course early on is that there are so many things that you can do with just a split second in your own practice. And most of the people, or many of the people you screen, or especially in my world, are going to have low scores, have low scores, but they but you want to focus on prevention. So I actually try to use the stress busters as a starting point for everything, because good sleep improves everyone's health. Exposure to nature, good physical activity, those things. So it's made me focus on preventive health, which is what we do as primary care providers, in a more deliberate way by connecting it to your physiology. But then just to quickly address the referrals, I think one of the things we've seen in LA is it didn't break the system. When we started screening, we have seen an increase in referrals, but what we've seen is better referrals. So people are referring to social work for brief interventions, acute counseling. People are referring to mental health services for anxiety. And then people are referring to many of the other supports we have, like nurse care managers, community health workers, et cetera, for things like food instability or access. And so we're finding that the referrals are broader. And then again, I know you didn't want this, because we have also developed community networks. And so now I know the number of the regional center near my house. And I know I use an online portal to get kids referred to the Boys and Girls Club or to an adult aftercare program if they have developmental challenges. And so I'm learning the system that exists outside of my practice so that I can integrate better. And that's what we mean when we talk about developing networks of care. And it does take time and energy, but it hasn't broken my clinical visit the way I think people have been worried about that happening.
Yeah. It's great to get a sense of that, because I think a lot of us do feel like my clinic visit is so full already. How do I add more? And so I think what I'm hearing you say is that it's not more, it's different.
It's just better. I feel like I'm better.
Yeah, that's awesome. I'd love to think about, well, one attendee asked a really cool question, which says, my ACE score was 7. How did I achieve what seems to be success? No drugs, no rests, no divorce, though I daily do have personal distress. So I just want to use that to emphasize the broad outcomes of folks who have ACEs. And we've been hearing about positive childhood experiences. So can you comment on that and share a little bit more, please?
So I'll just say a quick thing, and then I'm sure Makai will be great to answer this. One of the things we did when we embedded the ACE screen into our algorithm or our workflows is we added a question that actually came from a validated survey. For kids, we ask, what is your child's strength until you're like 12? And then after that, we ask, do you have an adult you can turn to in times of stress that can support you? And adding those two questions to the ACE score really framed it in a more positive light. And I've been really excited to see how, and Nancy can probably comment on this too, how when you talk about someone's adversity and then you already bring up what are their strengths and their resilience, it leads to a great conversation. I had a parent tell me that their 8-month-old strengths was that she knew the difference between their cry when they needed a diaper change and the cry when they were hungry. And if you see a parent noticing that as a strength in an infant, that promotes all this discussion about bonding. Same thing when you talk to a teenager about what it's like to have an adult, have a responsible adult, whether it's a coach, a teacher, an auntie. Capitalizing on those relationships brings us toward the discussion about positive experiences and resilience. So I think we all understand that we're asking about toxic stress in a way that talks about challenges, but we're trying to reframe the conversation so that what you end up talking about is strengths.
That's great. Makai, do you have anything to add to that? Yeah, please.
Yeah, just a couple quick things. I would say one of the real important things for ACEs Aware is that we're training providers on diagnosing risk of toxic stress, and not to be deterministic, but based on population health data and the presence or absence of ACE-associated health condition, that we're diagnosing the risk. And then also there is a lot of science and emerging science on the role of protective factors and the buffering role of protective factors in support of adults. And we didn't have time as much to talk about that today, but I think we talk a lot about in our trainings the role of protective factors in kind of buffering against the impact of ACEs.
Okay, great. I want to give Dr. Sood a chance to wrap up, but I have one more quick question from the audience. I mean, I have hundreds of great ones, but one more that I'd like to ask you right now, which is, we heard that huge number, $1.5 trillion of cost for California. And so that makes that number that sounded so enormous before, the 4B with a billion number, seem pretty small, like a drop in the bucket, but well worth the investment. And we're hearing about, for example, reimbursement for the screening. I think it was alluded to that there's reimbursement for response to the clinician's response time. Can anybody mention, like, are there other CPT codes for funding for the response to this extra counseling time, et cetera? Or is that kind of in the works? Feels like to me that prevention and early treatment is a worthwhile investment to prevent that downstream cost.
So just quickly, what I would say is the current, all of the new changes with healthcare reform in California are leading us toward reimbursement for response activities. Most of those are not based in the primary care setting, so they're through well, certainly enhanced care management is, but it's not directly provided by the providers, by your nurse care manager. Some of the other services like non-specialty mental health services, community health worker benefit, those things are all now becoming reimbursable. And I think that may be what you're alluding to, that if you can get your patients involved in those support services, and also mental health services, which there's much more access now. If you can get them involved in those, they may not be reimbursable to you as the provider, but they are available to your patient through others who then get reimbursement for that. I don't know if Micaiah, if you want to add, or Sohail, but that's how I see it. And yeah. So in a way, it's helping the work spread out into a broader arena with the right people getting the compensation for the work they're doing.
I think it looks like Kim's internet may have had some issues at the end here. In addition to that, Shanna, I would just add that when something becomes reimbursable, then ideally it also becomes sustainable. Right. So that's part, I think, of the strategy here, is to develop mechanisms by which this work cannot be just one-time grant funded, but really find a way to be embedded within the ethos of the way we deliver supports and services within the state of California. So I'm really optimistic and hopeful that this provides a substantive change. There's new mechanisms, and then there's new provider classes also that are coming online, be that the community health workers, peer support specialists, certified wellness coaches, a new workforce we're standing up through the Children and Youth Behavioral Health Initiative. So a lot of exciting work there.
Thank you. I'm sorry to everyone that I keep disappearing. The magic of the internet is not working for me today, but we are close to the end. First of all, I just want to thank this panel so much for presenting today's content and everyone listening in. Reminder that we're going to receive the survey around 5 p.m. to attest to attendance, so please do complete that, and especially today because you have the opportunity to get means of certification as well. And our next session is a really great one about gender affirming care in July, so the second Tuesday. And then Dr. Sood, would you like to close it out with any parting thoughts?
Tremendous gratitude to Shannon, Micaiah, and especially Nancy for joining today and sharing the wisdom. Thanks to you, Kim, and to the California Medical Association for hosting. My ask of everybody on this call is to take this as something for you and something for your patients, right? And so the something for you is what Shannon presented about the tremendous amount of resources to get trained, to provide services, to think about your clinical setting and how you can engage in screening and managing ACEs. And the something for your patients is what Nancy and Micaiah focused on, about sharing the information, engaging with the Live Beyond campaign to make sure that everyone is aware that they can indeed live beyond. I love how Micaiah put it, ACEs are not your destiny. So thank you.
Once again, thanks to everyone, and we look forward to seeing you in July. Have a great day.